It's Nerd Out time!
Hell yeah! Well, it's Nerd Out time! That's right, baby! Let's save some lives today. At least teach you how you can if somebody is unconscious. And this is, more specifically for an adult. We can go through separate things for infants. Really, it's pretty similar. You just don't push as deep when we get into the compressions and things like that. We'll devote tomorrow to choking, something like that. But today I just want to talk about if somebody's unconscious, right? You see someone, what do you do, right? So first thing, you check the scene for safety. You're doing this really quick, though. You're in a normal scene. Right away, you're going to tell somebody else to call 911. You call 911. All right. They do that. If the person's on their stomach, you roll them onto their back, and you make sure they're on a hard, flat surface, okay? Now, at that point, you're going to ask them if they're okay, right? Which you've pretty much kind of been doing simultaneously where you told someone to call 911. If they're non-responsive, within a few seconds, begin CPR. So what you're going to do is you're going to take the heel of your hand, you're going to put it on the center of their chest, and you're going to place your other hand on top, and you're going to compress about 2 inches deep. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. All the way up to 30. Elbows locked out. Boom, 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 boom. All the way up to 30. Now, if you're not trained in CPR, just keep going with the compressions. Just keep compressions until the help arrives. Now, obviously, if there's something in their throat, you check to see if they were choking or something, if you didn't see how they went unconscious. But this is really, kind of if someone just went down, there wasn't obvious signs they were choking or something like that, in which case we'd get involved in the Heimlich maneuver, which we'll talk about tomorrow. But I want to make this very brief because it's important, so you just get the point. You're going to go 30 compressions. Now, if you're trained or if you want to try it, if you're comfortable, you give 2 breaths after 30 compressions. So you are going to tilt the head back and the jaw. You're going to open the mouth and you're going to close the nose and give a gentle breath, just enough to raise the chest, to put air in the chest, to raise the chest. Then continue again with compressions until help arrives. So, it's something that's good to know. It's very simple, but hey, if you don't practice something like that, if you don't know the exact steps, maybe you won't know what to do when the time comes, and now maybe you can save a life one day. Hopefully you're never in that situation, but you could. Good job, test subject. We revived her. Look, she's good. She's ready to go. So that's what we got for you guys today. Something I think is definitely useful that we all should know. Who do we got? Let's say bye to the Evo. What's up, baby? How you doing, man? How you do CPR on somebody? Hey, yo, what up? X to Galgano. What's happening? How you doing? Hope you're having a great day. Thank you guys so much. We'll see you tomorrow. Say goodbye to Smokey Bear. And have a great rest of your day. Say goodbye to J-Mo as well. Happy when wellness. Thank you.
Yeah.